Independent Member Clark.
Lowest of the line.
Thank you, Mr Speaker. My question is to the Premier in his capacity as Minister for Health. Premier, Morton Group Medical Services has been partially funded through the Primary Health Tasmania to provide health care from 6 p.m. on weeknights at no cost to patients. These pop-up clinics visit the Elizabeth Street Mall and similar locations, targeting the most vulnerable in our community who simply cannot access a GP, either because finding a GP who bulks bills is close to impossible, or in any event, most GPs have closed their books to new patients. Unfunded activities of this service include a clinic at the Glenorchy Salvation Army and Flint House, where bulk billed healthcare is provided. Funding has been sought from the Primary Healthcare Grants Round 3. This funding would have allowed the continuation of unfunded daytime services and the expansion of other services to 5 days a week. Sadly, the service was unsuccessful in their funding request, and as a direct result, daytime services at the Glenorchy Salvos and Flint House now must cease next month. Premier, this is a low-cost service that has been philanthropically funded by the Morton Medical Group Services, run on very little money but a huge amount of goodwill. It is exactly what we need because clients now will clog up the Royals Emergency Department, which is exactly what we must avoid. Premier, an ounce of prevention is worth a pound of cure. Will you revisit the funding of this service that helps so many people who otherwise cannot see a GP?
Honourable Premier.
Well, I thank the Honourable Member for her question, and it is a very important matter. And it's a matter of timely access to our primary healthcare service. And our primary healthcare service, whether it be access to a GP, and I've mentioned indeed the cutting of red tape when it comes to reforms in the area of pharmacy today, Mr Speaker, as well. And what you have highlighted really has been what is long-standing neglect from a Commonwealth government.
The last 10 years.
Mr Speaker.
Always someone else's fault. It's always someone else's fault.
Well, primary health care is the responsibility.
Order. Miss O'Connor, order. Premier, if you could address your question through the
Primary health care is the responsibility of a federal government, okay? And I'm pleased with the way that we are working with the new federal government in this space.
That's right.
And there's a number of examples of that. But it is primarily a responsibility of the federal government. And the point of our after-hours service is the Tasmanian government reaching in to federal government responsibility and investing. So the policy settings that we have are the right policy settings. Now, one of the biggest challenges we acknowledge in health for Tasmanians is access to an affordable general practitioner. In fact, we hear from our GPs across Tasmania.
You've made it worse by removing PCR testing.
Order, Miss O'Connor.
And the AMA
fourth time today
is that Medicare does not reflect the increasing costs of delivering primary care services. This is making it more difficult for all Tasmanians, especially vulnerable Tasmanians, to access the care they need when they need it. And I'm aware of the Morton Group and the work that they have done, and indeed through the pandemic, the service they provided in cooperation with the Salvation Army, if my memory serves me correctly, around ensuring access to vaccinations for vulnerable groups in our community, Mr Speaker. Now, Mr Speaker, for our part, we have introduced an $8 million GP after-hours support initiative to help to increase access to GP services for Tasmanians. The initiative provides financial assistance to GPs and other service providers to offer after-hours and extended services to their local community. The latest round, of which I believe you're referring to, of this initiative prioritise support for vulnerable Tasmanians across the state, including those experiencing homelessness, who may find it particularly tough, of course, to access GP. As with all funding under this initiative, the Department of Health is responsible for receiving, reviewing and approving all applications. I'm advised the department also engaged an external probity advisor who provided advice and guidance to the panel who were established to determine the successful applicants. And I certainly appreciate that some providers may be disappointed to miss out in this round, but I can assure the member that the programs, of course, are done and at arm's length from myself as Minister. I am advised, however, that unsuccessful applicants were provided with the opportunity to receive feedback from the assessment panel, and I would certainly encourage any organisation to take up that opportunity. I want to assure you, given your interest, and thank you for that, our government is committed to providing all Tasmanians with the health services they need, and we're also committed to supporting our primary health care providers, of course, where we can. I'm pleased to say that we will soon be launching another round of the GP After Hours Support Initiative, and of course I would encourage all and any interested organisations to apply, and thank you for the question.
Mr. Speaker.